what you're gonna do, you're gonna flex the knee and passively flex them again. And if they report pain in the same degree of range of motion, then you're suspecting some type of serious pathology. So we would perform that test, but we would also be looking for these other things like a swollen buttock, a non-capsular pattern of restriction, as well as they have painful and weak hip extension. So all of those would make us think a serious pathology. But we would start with that hip flexion, okay? They report pain that's out of proportion to the injury that you're thinking. You would flex the knee and perform the same test, and they would report pain at that same range of motion. Then you would start looking for those other components to see if this is something more serious in nature. Okay. I'll have you sit up for me, please, facing that way. Also from MSK1, we have the tripod sign. So this is where a patient might be positive if they have tight hamstrings, or they have an increased dural tension, or we're stretching the sciatic nerve. So a positive test would be, as I go to passively extend that knee, she's gonna extend backwards. So she would extend backwards like that to take pressure off the hamstrings or the sciatic nerve, okay? That would be a positive test. So you would come back up. So say this is the non-symptomatic side, I would extend the knee, and you would stay in flexion, okay? The other side, I extend the knee, and she goes back into that position, okay? To take pressure off the hamstrings or the sciatic nerve. So I would have to ask questions. Does this feel like more of a muscular tightness in the hamstrings, or are you getting more that radiating pain down into the leg, okay? So that's how you would differentiate between sciatic nerve or tight hamstrings.
So you only have to lean back on the symptomatic side?
No, they will lean back.
Oh, okay.
So as you passively extend them, they're gonna lean back to take stress off of the hamstrings or the sciatic nerve, okay? Because if they're in flexion, I extend the knee, you're tensioning that sciatic nerve on both ends, or you're going into hip flexion while the hip flexion, and that's gonna tension the hamstrings as well too. So you would just have to understand the character or the nature of the pain that they're having.
Does the degree of the lean matter, like significance?
No, they're just gonna go back into extension, and that would be a positive test. Okay. The flip sign, okay? So this is related to if they have any dural tension, okay? So I'll have you supine. So what I could do, I'll have you straighten your legs. I'm gonna extend this leg. They're gonna report symptoms in the sciatic nerve distribution. So almost like I'm performing that passive straight leg raise test, okay? If that's positive, what I can do, I can have you sit up for me and perform that same test, okay? If it is negative, then that's a flip sign, okay? So if they report pain, I'll have you lay on your back, okay? So this is essentially tensioning the same thing. So if I extend here and you're reporting sciatic nerve symptoms out of the proportion of injury, I can have you sit up and do the same thing. You should report the same irritation, or you might show that tripod sign with that. If it's not, that's a flip sign. You're thinking there might be a yellow flag present, okay? It might be something out of the proportion, like they're exaggerating that, or it's just not congruent with what you're seeing in both positions. Because if I stretch the sciatic nerve in supine, and I do it here as well too, the patient should have the same response. But if I'm doing this and they're like, oh no, I'm fine, I'm okay, then you're thinking something else might be contributing to their symptoms. Some yellow flags or something like that.
So you said that they have the pain when supine, but then when sitting they don't. That's positive?
That's negative, I'm sorry.
That's
So what you're looking for is the pain to be reproduced in supine and sitting. The same thing.
Pain in both positions.
Pain in both positions.
Is considered flip side. Pain in supine, pain in sitting
That's a positive.
is positive flip side?
Yes.
Yes.
Okay.
Yes. So pain in supine, I'm also looking for the same pain to be reproduced in sitting as well too.
Positive.
Positive.
Either that or try.
Or it would be the same thing. Like, yeah, it would be the same thing.
Have you seen a patient present this way where you did the
Mhm.
flip side test and then you did this and it was negative?
Correct.
So in that case, what did the patient come to you for?
So I would keep that in the back of my head, and I would continue my objective exam to see if there's anything else contributing. So they may come in with sciatic nerve pain. I'm getting radiating pain down my leg. I perform that straight leg raise test. Oh no, that hurts. And then I just check it to see, because if you're having severe symptoms with that straight leg raise test, and then I perform this test, which is increasing that dural tension in the sciatic nerve distribution, and it's negative, then I'm thinking something else is going on.
So when would you know to do this rather than the slump test?
So you can do it that's all kind of part of your objective examination, kind of your cluster, what you're looking for, okay? So it's all a part of your cluster that you would do to examine your patient.
So it's just like putting it together.
Able to document this actual kind of like a slump test? You can literally just do the slump test and see.
So
The tripod at the same
so the
time.
slump test, again, you would, your hands behind the back, you're having them slump down, you're increasing the neural tension here. This is more of a test where, I'm trying to rule in or rule out a yellow flag that I see.
One more question. Is there ever a situation in which it's the opposite way around, where they will feel the dural tension in this position, but in supine, they have no pain?
It could be, and then I'm thinking it may be a hamstring. They just have to, so it's more about out of the proportion of what you think is going on. So they may report symptoms in this position. I might continue and do the slump test to see if it's truly sciatic or dural type symptoms. So it's just all a part of your clinical reasoning and how you're gonna apply these tests.
So a positive flip side test is when they present symptoms in supine but not in seated, or a positive flip side is symptoms in both positions.
Symptoms in both positions.
Okay.
Symptoms in both positions. Okay.
So whenever there's a positive tripod sign, it's a positive flip sign?
No. So the flip sign, you have to do both portions of the test.
Okay.
So the flip sign, you have to do supine straight leg raise, and then you would assess it here. And then a tripod sign is just patient is you would passively extend their knee, and you see that flip sign. So if I'm performing my objective exam and I'm going through my preces, part of that is looking at knee range of motion, active and passive. So you could, okay, let me see your knee range of motion, and you see them do that. That would be a positive tripod sign. So it's not like something you have to isolate and completely do an entire new test. Like, okay, I'm gonna do all of this, and then I'm gonna do the tripod sign. It's something that you're gonna see during your examination. You extend their leg, and then they're gonna go back into that position. That would be a tripod sign, and I'm thinking, is this coming from hamstrings, sciatic nerve stretch, and then I would progress on with my objective exam.
So when it comes to like documentation, obviously like that one has the straight leg raise, so you would document positive straight leg raise plus a positive flip sign.
Yes.
Oh, okay.
Yeah. Let's try those. Just review your sign of the buttock, and then let's go over tripod and flip sign.